Hello, everyone. My name is Gabe Howard, and I am very excited to introduce the first Psych Central Live Managing Your Mental Health and Coronavirus and COVID-19 is going to be very, very exciting. Please, during this whole process, say anything that you want in the comments, ask questions. We'll try to incorporate them into the show. But before we get started, we should introduce our very cool panel. Dr. John Grohol, would you like to start? Just tell everybody who you are and why you're here.
Yeah, sure. Absolutely. Happy to be here with all of you today. Really excited about what we have planned for the chat. I'm the founder and the editor-in-chief of PsychCentral.com. I run the show and have been doing so for the past 25 years. And it's my training and background as a psychologist, and I enjoy that, but I also do a lot of writing and editing as well. So I'm happy to be here. Thanks.
John, welcome to the show. And now let's move on to Dr. Marie. Dr. Marie, please introduce yourself and tell us why you're here.
Thank you, Gabe. I'm very pleased to be here as well. I am a licensed psychologist and marriage and family therapist. I've been doing this work for almost 50 years at this point, which stuns me to think about. And I've been working with John for a very long time. John, I've lost track of how many years, both as a feature writer for PsychCentral.com, and also I'm part of the Ask the Therapist team, where several of us respond to questions really from all over the world every day. So I'm very happy to be more live and in touch with some of our readers.
Thank you so much, Dr. Marie. And last but certainly not least, Summer, please introduce yourself and tell everybody why you're here.
Hi, well, my name is Summer Bukevich. I used to blog for Psych Central, and both as a contributor to the World of Psychology blog, but also for the Panic About Anxiety blog. It's been about 5 years or so since I've written. I am not a psychologist in any way. I'm actually a college professor right now working on my dissertation, but I'm really coming to this conversation today with the patient perspective. I have been dealing with panic disorder for about 15 years now, generalized anxiety and things like that. So I'm hoping to add my voice to the conversation today.
Well, Summer, thank you so much for being here. And you blogged about anxiety, you live with anxiety, you know a lot about anxiety, and that just seems like the best place to start, right? A lot of people are very anxious about everything that's going on in the world. If there was one piece of advice that you, and I'm going to pose this to the rest of the panel as well, have for folks right now, what would it be? Summer, you're first.
Control what is controllable. There is so much out there that we have literally no control over, whether that be the transmission of the virus, whether that be the way the news is handling the virus, whether that be whether or not your parents or family or friends are listening to the social distancing recommendations. At some point, you just kind of have to let go and say, all right, what can I control in my world? I can control my social distancing. I can control certain elements of my household life. I can control how I think and how often and for what duration of time I think about all of this in any given day. So to just focus on those things, because I think one of the key pieces that we're all struggling with right now is that frustration and that anxiety over the lack of control.
Summer, thank you so much. Dr. Marie, I'm going to pose the same question to you.
Well, I want to support everything that Summer just said. What occurred to me instantly when you asked the question, Gabe, was limit how much news you're consuming every day. It will make you, if you're an anxious person by nature, checking Facebook, with all due respect to Facebook, but checking every other minute is not going to be helpful. I am a news hound myself, so this has been a real discipline for me, is to limit my number of contacts with the news media and with what's coming through from my various friends and associates to only a few times a day. And even that can be overwhelming. So I think all of us need to assess ourselves as to how much is enough and how much really is only making us more anxious instead of less.
Thank you so much, Dr. Marie. Dr. John, you're up.
Yeah, to add to that, I would just say there are still a lot of people in the population who aren't taking this seriously, who don't believe that the coronavirus outbreak is something real or something that's going to spread nearly as much as the public health experts have told us. And so they're not really practicing social distancing. They're not really taking the kinds of precautions that the CDC and other government organizations and agencies are recommending. And that hurts everyone, because you can have symptoms of, you can have the coronavirus without symptoms. You can not have any symptoms and be a carrier of the coronavirus for days on end. And that's a real concern. So for people need to take this seriously, and then they need to follow the precautions that public health officials have laid out. Very simple things, things that we can all do together. That means not going out if you don't have to. If you can stay home from work and work from home, doing that. A lot of schools have canceled. Washing your hands regularly, especially if you go out. Avoid touching your face, and avoid anybody else who appears to be sick. So if someone is coughing or sneezing around you, get away from them, because the coronavirus is very transmittable, unfortunately. So,
John, I want to underline that. I think the math is sometimes daunting for people. I did a little research a couple of days ago. The average person has 12 social contacts a day. That includes everything from your mail carrier to someone you say hi to in the grocery store to people, just your friends and your family. 12 a day. So if you're asymptomatic and you are in interaction with those 12 people, that's 12 people who might catch the virus, who each then goes and talks to 12 other people. And this just keeps growing and growing. I was beside myself when I saw the kids on the Miami beaches. To me, that's a petri dish, a dish of germs just exchanging one to the other. And not only was it irresponsible for the individual, but each of those people was then going to go home to another state and maybe take the virus with them. And I think that it is so daunting that it's easy to be in denial about that, or want to be in denial about that. Who wouldn't want to be in denial about that? But that's what we all have to take very seriously, is that if we become a carrier, then we are setting in motion. It's like the old pebble in the pond analogy. The rings go out and out and out from ourselves. I think one of the scariest things about this is you can be totally asymptomatic and be a carrier. So I would underline that part of our social consciousness, as well as self-care, and maybe a way to reduce our own anxiety. It's what Summer was saying, what can we control? Well, what we can control is not be part of the problem. And that does mean limiting our social contacts. I don't know whether this is happening in your parts of the world, but we have what we call geezer hours for the grocery stores. And as one of the geezers, I appreciate it a lot that from 6 to 7:30 a.m., only people over 60 can be in the grocery store. That is, on the one hand, a very simple intervention, but it's cutting down the number of contacts. Each of the individuals who we do need to eat, we do need to go get stuff, but it immediately cuts down the number of people we might be in contact with. And I will say, at least in my town, people are taking that very seriously. People are staying 6 feet away from each other, even in geezer hours. So it's been very helpful. So let's respect those kinds of interventions that people are doing to support us.
I have a question to pose for the group, especially given our ages are all different. I would never presume to guess anybody's ages, but we're all different age. I think Summer is the youngest, and I don't know who the oldest is. It's probably Dr. John.
I think I'll claim that award.
No.
I'm glad that you brought it up. One of the things that you see constantly when we're talking about going back to what Dr. John and Dr. Marie said about how serious should we take this with the warring messages, et cetera. And one of the things that I hear over and over and over again is that, oh, we don't need to worry about this. It only gets you if you're old or already sick. Well, as somebody who is already sick and is a group of people who has at least one person who confesses to being old, how does that make you feel, that quick dismissal that, oh, well, I'm going to be fine. I don't care if you die, because that's kind of what it sounds like. And I fear that's what people are hearing. And let's start with Summer.
I think it's painful. So I have a pre-existing condition that puts me at risk. I have asthma. In the fall, one day when the seasons changed, like the temperature just suddenly dropped one day and I woke up and I couldn't breathe. And so I keep thinking, if that can happen on a random day in the fall because of a temperature change, what can happen if I got this virus in my system that's very well known for causing significant respiratory distress. So there's that. And, the fact that on the news, I keep seeing a lot of additional reports saying, I'm what I like to call an elder millennial, and I stole that term from some comedian whose name I don't remember. There's a lot of people in my age group who really are getting sick, and it's hitting them significantly. This kind of deviates a little bit away from your question, Gabe, but the other thing that I wanted to mention too, just about my general age cohort, and I'm in my late 30s, I'll say it, late 30s. But a lot of people in my age range have jobs and have children. Well, hopefully they have jobs now. Everything's kind of going crazy, but the idea here is that there's a lot of people, at least in my social network of my general age, who are dealing with young children at home right now, which is really, really challenging. To go from working and sending your child to either daycare or preschool or, K through 12, and to suddenly not have that support system in place, I think is a real struggle right now. For people my age, not just a logistical struggle, but I think it's something that has the potential to really take a toll on one's mental health as well. I've been even just personally feeling a lot of guilt for letting my kid spend time in front of the television. We wanted to keep the iPad away until she was like 5 or 6. That's out the window. That's out the window. We've got a whole bunch of apps for her now to play with. And, so I think people in my age cohort, one of our big challenges is learning to relax our expectations that we've set for ourselves over the past, God knows how long, we might have had those expectations, but it's sort of like it's sort of like transitioning from being a perfectionist. This is how I feel, at least, from being a perfectionist to being okay with being a B or C student within a matter of 2 weeks. So I think, like I said, I think that I went on a tangent there, Gabe, but still important stuff worth mentioning that's been on my mind. So
I think it's an excellent tangent, and I do want to give a shout out to Eliza Schlesinger. That is who you stole that from.
Yes.
She is awesome in every way.
Remembering.
You are very, very welcome. Dr. Marie, moving on to you, because you brought up the geyser hours.
I couldn't hear that, Gabe. What did I bring up?
You brought up the geyser hours.
Oh, yes.
I'm making air quotes so that I don't get hate mail.
Okay.
But you sincerely, people say it only impacts the sick and the elderly.
Well,
And
first of all,
yeah.
Gabe, that's very old news. That was the original assessment of this disease. And part of the reason the numbers were skewed in those directions was because of nursing homes where, of course, people are in close contact with each other. And I believe it was in Washington State, a number of elderly people died in the same nursing home. But as the weeks have gone on, we're now finding, it's not me, the researchers are finding that the age group between 18 and 44 is in fact most at risk. The other reason that the numbers got skewed is, frankly, there are more boomers than millennials still. So of course the numbers are going to get skewed. But I think the most important takeaway from this is that we're all at risk. Babies have been dying, teenagers have been dying, middle-aged people have been dying. I do take exception to the lieutenant.
I think Dr. Marie bopped out. While we're waiting on her to come back, Dr. John, as the second oldest person in the room, and you're dangerously close to that 18 to 44. How does that make you feel?
As Dr. Marie was saying, I think that we now know that the initial numbers with regards to different age groups aren't nearly as drastically different as we had originally thought. So it likely is, just like any virus outbreak or flu outbreak, these things always impact people that have compromised or not as healthy immune systems. So it's not surprising to see a slightly elevated rate of death in people like that. But people forget, you can have diabetes and be at greater risk for dying from the coronavirus. So, and as we know, something like half of Americans have diabetes, or a quarter or something. It's a huge number. So there are a lot of other conditions that put you at greater risk for having much harder time with coronavirus. We shouldn't discriminate against anyone, age, gender, whatever, based upon, hey, it's not going to affect me. We're finding out, and we're hearing stories every day, how it affects people that were perfectly healthy, young, old, middle-aged, doesn't matter, healthy one day, and you could be dead within a week. So
I think, John, people saying it's not going to be me is one form that denial takes.
Yep.
And it's just yet another form of, well, I don't really need to think about this because I'm the wrong age group, or I live in the wrong city, or I'm immune because I live out in the country, or whatever. There are lots of forms that a kind of functional denial can take, because we can't live in terror every minute of every day.
Absolutely.
I think the fine line we're all walking is, how do I take this very seriously and yet not be terrified every minute? And there are various ways people do that, some by very consciously doing things like meditation or some sort of self-soothing.
Mhm.
And frankly, denial works as a way of coping, as long as it doesn't get out of control. So to you, Summer, what do you think?
Yeah, specifically, Summer, my question is, this is kind of a coping mechanism that
Yes.
people like me with anxiety, that we learn, so that
Yeah.
we take the risk, so we understand how much we should worry. But it's, as we've just been discussing, it's also, oh, I don't have to worry about this because I'm not 1, 2, 3.
Right.
So talk about that. There was a question in there somewhere, I swear.
Yeah, no, that's okay. So I guess to speak to the whole, denial piece, I have a hard time identifying with that, because in my own experience with anxiety, I've never been able to deny anything, right? Like, so a lot of the anxiety that I've felt in my life has been physically based, right? I'll feel my heart racing and I'll be like, what's going on? Is that a heart attack? What's happening? So I'm hyper vigilant and hyper responsive to these sorts of things. But I absolutely know that there's other people too who feel similar sensations and say, yeah, that's nothing, just to help them feel better, right? And, maybe not in health related situations like that. I still don't think that's the best, approach. We have to use caution with our bodies. But especially now, when we engage in that denial, we're potentially putting ourselves and other people at risk. So I think it's, it's especially bad now. And Gabe, did I even hit that question that you asked? I'm still not even sure.
No,
You know what, Gabe?
I think that Summer and Dr. Marie both bring up a great point, that there's an element of we're just going to deny it, so we don't have to worry about it. Since we don't have to worry about it, we can move on with our lives. This is somebody else's problem, and in fact, everybody's overreacting. And most specifically, there's so many warring messages on the TV, we can just kind of pick the one that we want, right? it's like choose your own adventure. One politician is saying that it's a hoax. One politician is saying that we're all going to be dead tomorrow. One politician is saying moderation is key. So just pick whichever one you already agree with, follow that news channel, and boom, we're good. How do we break out of that silo and get real information so that we can keep our mental health sane?
Well, the problem with that, Gabe, is in order to break out of the silo, you have to want to. If you don't want to, you're not going to. And again, it works as a coping coping means. It does work. But as Summer said, it's to the detriment not only of the self, but others. I'm just wondering, having touched all the very difficult information, if we can shift a little bit, Gabe, to what people can do to feel better besides denial. I talked a little bit about meditation being one thing. I do think that to the extent that we can, if we can get out of ourselves, it's helpful. In my community, and I did see actually on Facebook yesterday, there are a lot of people who are breaking out sewing machines and making masks. A major clothing store chain is now offering free instruction and free materials because we have a desperate situation where there's not enough protective equipment. And we're now seeing healthcare workers being compromised, terribly compromised, and being made ill by taking care of others. Well, if we can be part of the solution, it feels like, back to what Summer said initially, that's something I can control, that there are things we can do. We can go to geyser hours, we can make masks, we can provide for other people in our community. One of the things I am painfully aware of is how much some of my colleagues who are working in human services are suffering with the lack of paychecks. So if we have extra, let's pass it on. It's a good time to pay it forward, be it money or food supplies or whatever people need. So let's just talk a little bit more about what we can do.
That is an excellent idea. And I'm sorry, Summer, continue.
No, that's okay. Dr. Marie gave me an idea here. So she, had mentioned, what is it that we can do? And, it keeps kind of occurring to me over these, these strange, unusual days, that, the typical anxiety response is that fight, flight or freeze response. And so we've, biologically speaking, I don't think we're used to being in situations where we have a great amount of anxiety and we can't solve it by actually going out and doing something, right? I feel like that's our body's first response, right? We want to go out and change something and do something to fix the problem. But that's exactly the opposite of what we need to be doing, right? So to Dr. Marie's idea of finding some way to be productive or to contribute toward efforts, I think to some degree can sort of like satisfy that need, that drive we have to feel like we're helping to solve the problem in some way.
Yeah, I agree. I think that that's fantastic, and those are two very good strategies and ways to cope. I would just add to that people should fall back to the ways of coping that they've used in the past that have worked for them. If you've had any challenges with your mental health or with any times in life where you've needed some help and you found something that worked for you, this is a great time to employ that coping mechanism again. There's some great ideas that can help people actively reduce their anxiety, thinking about the coronavirus. Meditation exercises, deep breathing exercises, mindfulness exercises. These are all things that people can learn how to do online for free. And it's just watching some YouTube videos or reading a few articles. And before you know it, it's if you practice them, you will start to feel better. But you have to take an active interest and desire to want to do those things.
We have a question from the comment section. Thank you so much, Liz. And of course, the minute I looked over, it just popped away. The question is for Summer, and it said, in these trying times, how do you remain hypervigilant? Because we're told not to remain hypervigilant, and the news is constantly giving us new and creative ways to stay safe.
So I'm personally having a little trouble with the idea of balance right now. And I think this is something that a lot of people are feeling, right? I feel a tension between the desire to be hypervigilant, to stay informed, right? Because being informed does give me a sense of control, right? I like knowing what's going on. I like knowing how many cases there are in my county, etc. But I sort of envision it's kind of like a curvilinear relationship, right? If we know too little, that's not good. If we know just the right amount, I think we feel pretty good, pretty in control, pretty safe. But if we know too much, or if we're like using social media too much, that can bring our mood down and our anxiety up again. So I'm not sure if hypervigilance is a good thing right now. I'm really trying to quell mine a little bit, but it's challenging. I'm using distraction methods primarily, and I know, having gone through therapy on and off for 15 years, that usually distraction is not the method that we want to be using. It's a short-term, like, kind of Band-Aid fix, when you're having a panic attack, let's say. In the long term, you don't want to have to rely on distraction. You want to be able to rely on tools that you have within yourself. But right now, to some degree, I think distractions can really help, especially when they're really functional, helpful distractions. I wanted to find time to speak to this, so I guess I'll insert this now. But the fact that we're all like socially isolating, well, I don't want to say socially isolating, we're physically isolating ourselves from one another, right? The idea of social distancing, I think, is kind of a misnomer. We have to be physically distancing, but still we can use tools like Zoom. There's an app that I've been using with a lot of folks called Marco Polo. It's this back and forth video chat kind of app, which has been incredibly helpful. So I think we need to sort of redirect the hypervigilance that we would be using to bring in information about COVID, and redirect that so that we're being very vigilant of others, friends, family members, community members, and using those energies to check in on them and to socialize, and to try and use that as a way to distract us from just the pure news that's out there and the scary numbers. We don't want to forget that we still have these rich, complex social networks. We just have to approach them in a different way right now.
Yeah, I absolutely agree. I think it's I think what Summer just said is so important to keep in mind, that we're when people say social distancing, what they're really saying is physical distancing, and it's such a misnomer to say social distancing, because unlike any other time in history when we have had a virus outbreak, we now have a technology, the internet, that allows us to keep connected to people socially no matter what, and that's fantastic. And I think that's really going to be of great help to people in the coming weeks and months, as we learn that we're going to have to keep that physical distance going for longer than I think most people are prepared to do.
And people are doing that. I know of book clubs. I know of autoharpus, because that's my thing. There are many people who are creating Zoom-like or Google Hangout or various platforms that allow people to have this kind of face-to-face encounter, as well as through the keyboard. The teenagers are probably the best at it. Part of the challenge for parents of teenagers is that balance again of how much of that is helpful and how much of it isn't, and to stay on top of that. And I also agree with Summer that distraction has its uses. I am the grandmother of a 2-year-old who lives here with me. By the way, there are over 4 million grandparents who are raising grandchildren of various ages. I'll tell you something, when I'm playing Lego blocks, well, Duplo blocks, because we're on the big ones right now, or if I'm playing Let's Pretend, I'm not thinking about the virus, which is a good thing. He deserves that kind of attention. He deserves my focus. And you know what? I get as much out of playing with him as whatever I'm doing gives to him. So I was so glad, Summer, to hear you mention you have a 4-year-old home, because I was concerned, and I expressed to John concern that maybe we couldn't address parenting issues. I didn't know that you had children. You know, yes, it's very hard to have children at home. And I did have my grandson in part-time daycare. Full timing is difficult, but it's also really helpful. Children thrive on predictability. Children thrive on a certain amount of structure. And I'm not sure I would structure my day as carefully if I didn't have a child at home. So because he needs regular meals, and he needs a nap, and he needs playtime, and he needs outside time, and he needs intellectual stimulation, guess what? I'm doing a whole lot more of that than I might be if left to my own devices, when I'd probably play the harp and read novels. So our children can be a very positive, I don't like the word distraction, because there's some negative connotations for that for me, but they can be a very important mutual kind of help. We help them, and they are also very definitely helping us.
Mhm.
John, this sort of opens up a question. You live alone with your wife, so you don't have this forced structure, and that's my word, nobody else's, that a child would force you to have. I know that Dr. Marie is watching her grandson. Summer has her 4-year-old. What are you doing to pass the time?
Well, there's a lot of things you can do, and that's the fantastic thing about living in the connected world that we live in, is that we take for granted all that we have available to us that people even just 50 years ago did not have. We have an internet that can bring us any entertainment that you can think of. I mean, things that you don't even know exist, like a channel where it's just the train going down a track in different countries, and showing you the train's view of going down the track.
It's true.
And it can be very calming, but who knew there was a whole channel devoted to that? So, you know, some of the kinds of things that I'm doing more of, and thank goodness it's spring, is, you know, I'm going out for exercise. I'm going for walks. I'm taking advantage of the spring weather. And we are, we're spending more time. I work from home most of the time anyway, so this isn't a stretch for me. The stretch is not being able to socialize face to face with friends and family, and that's challenging. You know, being just a few weeks into it, it's not a huge deal right now, but I suspect that as we go, you know, into the second month, the third month, I think some of that face-to-face time is going to need to be replaced by things like this, where we can, hey, let's all chat, let's all FaceTime chat, let's all, you know, WhatsApp, or, you know, whatever. So I'm catching up on some old, you know, TV shows, exploring apps like TikTok, not for old people, and reading a lot more, and going out for walks. How about you, Gabe?
It does occur to me that all 4 of us have meaningful work that we're doing as well.
Mm-hmm.
Parenting is certainly meaningful work. So is grandparenting, by the way. But all of us are also engaged in something that for us is important and gives meaning. And I feel very fortunate that I already have that. I do think it might be helpful to people who have not had that, or maybe they've had jobs that they did for the money, but it wasn't particularly gratifying, to find something that they can do now that they're at home that does give them true satisfaction. And that can even be, John, the forums at Psych Central are amazing. So to be a regular contributor to one of the forums to help other people can be a very meaningful exercise. or
Yeah.
if there are people in the community, shut-ins, who could use a friendly face in a discussion over Skype, or to be checked in on, to do something that gives you personal meaning and that is kind and helpful to other people, can also be an incredibly important variable in this kind of situation.
Yep.
Can I
Thank you. Well, we
speak
have
to
another
the-
quiz. Oh, yes.
Oh, I was just going to say, can I speak to the idea of having small children briefly?
Please.
So some of the things that I know I've been doing, and, you know, Dr. Maria is right. Kids crave, especially younger kids, I mean, crave structure. My daughter's daycare is usually very structured in, you know, the way they lay out their day. And so I've tried my best to kind of repeat that, but I have to, again, tell myself, Summer, you're not gonna do a perfect job at it. But I'm happy if we at least get up, have breakfast, have some playtime, have lunch, have some screen time, go outside, etc. Sometimes that's the best we can do. Some other things that I've personally done for my daughter, and I recognize that there's an element of privilege here in that I am able to, you know, go on Amazon, and we've been toying around with the idea of getting a swing set for a while. I was able to pull the trigger on that because I said, well, now's a great time because the parks are closed. You know, I want my kid to not fall behind in like gross motor development and things like that. She's always a little like, you know, nervous at the park. So I said, if we're gonna, you know, if we stand a chance of even losing a couple months of being able to, you know, go to the park, I still want her to have a fun experience outside. That's not to say that everyone needs to go out and buy a swing set, but, you know, think about what you already do have. Think about what you can take outside for your kids. There's 800 ways to put together an obstacle course, right? Something cool, something that's a little bit out of the norm for them. The other thing that's going around in my town, and I know that this is happening in other towns as well, is a lot of communities are coordinating on Facebook to create things like called bear hunts or safaris, where people put stuffed animals or something else in their windows so that kids who are going on walks can feel like they're going on a bear hunt or a safari by, you know, pointing out the stuffed animals in the windows of a house. I know that I've heard some towns in Philadelphia are using like rainbows, and I think, you know, some people are doing Easter decorations. But how cool is that? That's still something fun for kids to do, right? It gets them outdoors, it gets them moving, it gets them exercising. And I think that's really important because, you know, I often sit back and I think, well, you know, my kid's 4. Is she really going to remember this? I fear that she will, but at the same time, I try and remember when I was 4, and I have like, I don't know, 7 maybe scattered memories of a few things that happened, right? So I need to remind myself as a mother that maybe she'll remember some pieces of this, but I want her to have good memories that I wouldn't otherwise be able to give her if we were living life normally right now. I can't be perfect. But maybe once per day, we can do something cool and unusual that is out of the norm. And that at least satisfies me, you know, maternally, making me feel like I'm doing at least something to benefit my daughter during this time.
Well, I think that's really cool. And we've got some suggestions in the comment section of what some other communities are doing that are really cool. One, there's a nationwide movement to decorate your house for Christmas because you're home a lot more at Christmas, so it feels very normal. I personally like that one the best. It's my favorite. But there's also Diana Buss says that Lewisburg is doing chalk art in the driveways, and the community comes together and does chalk art. Diana Buss agrees with you completely that she wants a swing set. She's been feeling it, and she's going to do it because you've given her the idea. Lots of great ideas about learning yoga, Tai Chi, things like that you can absolutely learn online and even do with other members of your family that are in the same house with you. And then we have a question from Dave Cox. And Dr. Marie kind of touched on this in the beginning. I don't know how old Dave is, but he says that how can I go to the grocery store to get what I need without having sheer terror? He's sort of indicated that he would rather just stay home and do without than risk it. But obviously that's not a good idea either because one needs food. So Dr. John, do you want to take a stab at that question first?
Sure. I mean, it is a challenge. Let's face it. I mean, there's no doubt that going to the grocery store today is something that makes us all kind of second guess ourselves, or something that we have a little trepidation about doing. And so I think you need to acknowledge that feeling. First of all, you need to accept the fact that, hey, it is a little frightening not to know whether you're walking into a store that is 100% disinfected, that you know that there's no coronavirus in there, or that you know 100% sure that there's no one who has COVID-19 or the coronavirus who's also in that store. There's just no way of knowing. So you have to find some acceptance with the facts as they are, since you can't change them. What you can change are the active steps that you can do to keep yourself as safe as possible when you're in that situation. And that means going out as little as possible, combining all of your trips into one trip per week, and going to the grocery store just, when you need to. And if that's once a week, or that's once every other week, depending upon your family size and how big a grocery order you can do. It means wiping down the cart with the wipes, I see, the grocery checkout people are wearing gloves. If you want to wear, gloves when you're in there, if you want to wear a mask, if you have a mask, you can wear it. It's probably helpful to some degree, but it's not not necessarily going to help you if you're not sick already. Masks are really for people who already have an illness, or for the frontline healthcare workers right now. We really don't want to encourage people to be hoarding or using, collecting masks unnecessarily, because the healthcare workers are really in desperate need of PPE. And then, having a list, going in the grocery store, knowing exactly what you need, getting it, getting in your car, getting to checkout, and just doing it all as efficiently and quickly as possible, I think is key. And then when you get home, again, you have to remember, wash your hands, take everything out of the bags, throw the bags away. Remember, these things can live on, the coronavirus can live on different surfaces for anywhere from 24 hours to 72 hours. So if you want to be extra safe, don't touch anything that you've bought for 72 hours. Basically, put it in the fridge, put it on the counter, put it on the shelf, and just be super careful about things. But I think just being aware and taking precautions, and trying to keep that 6-foot distance away from yourself and other people while in the supermarket all can help.
John, thank you, Summer.
I'd really love to speak to this because, having dealt with agoraphobia for so many years, and it was like a functional agoraphobia for the most part. I could go out and do things sometimes, but grocery stores were one of the things that I always struggled with. I think on account of the fact that they're large, right? When you go to the back of the store, you're far away from the exit. So, when you're getting those agoraphobic type feelings, you feel less safe, in certain areas of the store. And then there's the whole feeling of potential embarrassment if the anxiety gets so bad that you had to just leave your cart and run out. So I was sort of joking with myself as I was in the grocery store the other day. I was going through and I'm like, I've been training for this for like 10 years. I can do this. But so just to share some of the things that I do and I've done over the past few years to help me cope with the grocery store, even in non-COVID-19 times, include, as Dr. John had mentioned, making lists beforehand so you know exactly what you need to get. A lot of grocery stores have apps where you can look up products beforehand, figure out what aisle they're in if needed, if you don't know where they are to begin with. So going in with that level of preparedness, I think, can help. Another thing that I've done, not during COVID times, but just when I was dealing with agoraphobia, I would say, okay, it's scary to me to be in a grocery store for a half hour. So let me just do 10 minutes in the produce section, check out, take stuff to my car, reassess, and then maybe if I'm feeling up to it, I can, take the next step or sit in my car until I'm, calm enough to go back in again. Of course, now, I realize that might raise concerns about, well, boy, then you have to go through the checkout another time and, have more potential like touch points with other people. But again, I think it's a balancing act. I will say that my local grocery stores are doing a phenomenal job. And this is primarily for the people who are nervous to go, who haven't gone to the store in the past week or two. You can always call in advance and ask what kind of measures they're taking, to try and prevent the spread. I will tell you that my grocery store has, they have 2 cashiers at every register. One is ringing you up and the other disinfects the belt between every single person, every transaction. They disinfect the carts, and it just, they have lines taped on the ground to make sure that people keep the appropriate social distance. So I feel really happy with the attempts that they're making to clean. Other things that you can do too, if you have a phone, whether that be Apple or Samsung or whatnot, a lot of phones allow you to do contactless payments. I myself use Apple Pay. So when I do go through the checkout, I don't need to touch anything, right? I can just click a button and pay with my credit card that way. So that's another option if you're afraid of, actually touching. But I think standard practices like washing your hands when you come home, and we even go a little bit above and beyond in our household. We'll take our jacket off, we leave our jacket by the door. We've been washing jackets even. And if you feel really uncomfortable, wash your clothes when you're done as well. It's not too much of a big extra step, but if that's something that can make you feel more comfortable right now, why not? If that's something that can help you to go to the store and get the food you need, why not? It's definitely, I think, an easy enough step to take.
Okay, could I jump in on this one, please?
Yes, please.
All of those interventions, all those activities are really useful, Summer. And like you, I'm very pleased with what our local grocery stores are trying to do. I just wanted to make room for people to choose their battles. That if you can do all of those things, that's fine. But many stores will also do a delivery service, or you can order your food online. It's more expensive. If you can do that, you can. If you're able to afford it, that's another option. If you're one of the elderly, there's also still Meals on Wheels operating in a lot of communities. So again, in a time of high anxiety, we may decide that, okay, I'm not going to take on the challenge of the grocery store. It's more important that I take on the challenge of going to my doctor. And what I'm going to give myself permission to do is maybe put off the grocery store challenge for now. Ultimately, I think it's a really important obstacle to overcome in life, because we do need to eat, and not everybody can afford to be ordering Alaska salmon as their primary diet direct from Alaska in a box, or from Amazon. And of course, it depends on the community. My community does have a couple of stores that will deliver. You pay by credit card and the box shows up on the front porch. Another store has a service where you can put your order together ahead of time, pay by credit card, and then you pull up to the curbside and somebody puts it in your trunk for you. So I think it's important to investigate options, and it may be important to make some clear decisions about, well, what do I feel prepared to take on now? And maybe next week it will be different, but this is what I can do now, and be kind to ourselves in that way.
Yeah, and just because you're not having a good day today,
yes,
just because you're incredibly anxious today does not mean that that is going to be true of tomorrow. I myself have been really fluctuating here, and so giving myself that grace and that forgiveness, knowing that like it's okay. It's okay for me to be okay one day and not that okay the next.
Absolutely.
And that I will be able to turn a page. There will be, a bright spot. And, just trying your best to sort of organize those outings for when you feel confident.
Very cool. Thank you, everybody. In the comment section, there's a few ideas that I think are certainly worth mentioning. And one of them is to get together maybe with family and friends and do one trip for everybody. Give one person your list.
Yeah.
And have your mom go and bring it to all of her children. We always pick the mom and run it to all of the kids. That was probably a bad example, but maybe work with your neighbors or go like that. Send your husband. Said, send your husband and I'll stay home with the baby and then disinfect everything when he gets back. So just things like that. Thank you to the comment section. I'm sorry I don't have everybody's name. It scrolls in a way that I was not anticipating. This is our first time.
Yeah.
So we're getting into the last 10 minutes, and throughout the entire time that we have been discussing, the same question has come up over and over again, and it's about telehealth and the idea of is telehealth something that people should be using right now, or should they still go to the doctor, use the tried and true? And I know that's a huge can of worms to open up, because telehealth means so many things. There's online therapy, which is telehealth. There's online dentistry, which is telehealth, and your opinions of those might be different. So I'm going to leave it open to the panel to define telehealth and how you feel about it in the age of Corona. John, would you like to start?
Yeah, so first a story. I actually used telehealth in early February due to a back problem I was having that laid me up in bed. I literally could not get out of bed to get to an urgent care center, and my doctor's office was being of no assistance whatsoever. So I actually found a service through Google and used telehealth to help with the diagnosis of what my issue was, and to prescribe some medication that helped my problem, my pain. So I found, it was great. It was painless. It was easy to do, but it was also not something that I understand. It's not something that's available to everyone. I think my session probably was like $100, but even $100 paid out of pocket is not something a lot of people can afford. I think in terms of therapy, we've known for many years now that you can do therapy through video conferencing. You can do it through secure messaging. So absolutely, you can do therapy through telehealth means. And as we've seen over the past few years, that component has really taken off in telehealth, that people are doing more and more online therapy. So I think that's great. And it's a key opportunity to give it a try if you haven't already, because this is a great time. What better time to do it than when you should not be sitting, 2 or 3 feet away from another person in a closed space, right? So.
Yeah, and I would underline that the last place that I want to go right now is either a hospital or a doctor's office where there are a whole lot of other sick people. So I think this is a frontier that we're on in terms of the use and also the potential abuse of telehealth. I know I resisted doing therapy years ago because there was no way to see the person. And I know that for me, a good part of my information as a clinician comes from watching how people react to me, looking at how they present themselves. But now with this kind of video conferencing available, I'm more willing to do it. We have a lot to figure out in terms of licensing, in terms of billing, in terms of insurance. All of those practical obstacles are yet to be figured out. I do think that the virus is pushing us faster forward. I know one of my concerns about it, John, is I'm in the corridor of opioid epidemic as well. And one of the big concerns about telehealth is people who doctor shop. And it makes it more easy to go to 6 doctors and get 6 prescriptions. We meaning the United States, doesn't yet have a way of communicating doctor to doctor in an efficient way about what people are doing out there. That's not to say I'm against it. It's just to underline that it's not easy, that there are a whole lot of questions that have yet to be answered. And I think one of the few positive outcomes of the virus might be that some of these challenges are going to be taken on much sooner.
Yeah, and if I could speak to the same thing, really. So personal experience, I had a therapist appointment scheduled for last week, and I was so torn. I was like, I don't want to go into her office. Her office is in like a family practice center. I really don't want, so, I called her and sent a message, and she said, well, we can do like a phone or a video session if your insurance will cover it. Call your insurance and just double check. I called my insurance, and they're like, oh, we only cover telemedicine if you go through this service with these providers. So I said, well, I want to talk to my therapist. I don't want to talk to like a new therapist just so that it can be covered. So I think there's a lot of like kinks in the system to work out yet. I'm happy to say my psychiatrist did call me. I think things are changing week by week. I had a psychiatrist appointment this week, and she called me the day prior saying, hey, we're doing phone sessions now. You cool with doing a phone session? I said, oh, I'm cool with doing a phone session. That's much better than going into a hospital. So like I said, I think things are changing by the week. And I just feel kind of compelled to speak to these changes on a larger scale. I know that a lot of people in the disability community have been pushing for changes like this for years, for the availability of telemedicine and the availability to work from home. I was on FMLA leave from one of my jobs before due to severe anxiety, and I pushed for the ability to work from home, and it was no, you're not allowed to, you won't be as productive, etc. And I think people are very quickly realizing that it's not as hard as they thought it would be, right? So I think silver linings, I think that we're going to see some positive changes as we move forward for people in the disability community, disabilities of all types. So that's a good silver lining, but it is going to take time. But I think we're starting to march in that direction.
Summer, thank you so much for those thoughts. We have reached, we've got 3 minutes. We have 3 minutes, so we don't have time to get into a big question. There's been a lot of comments during this whole time, thanking us for doing this, thanking us for being so honest and forthright. Barb Bowman Craig says this has been really, really helpful. So I can't read them all because unfortunately I can't scroll back in time on Facebook suddenly. Not sure why. But Dr. John, this was your idea. Thank you so much for putting it together. Dr. Marie and Summer, thank you for spending an hour of your time discussing it. Are there any last words? Again, each one of you has about 30 to 45 seconds. Are there any final words that y'all want to offer? We'll start with Dr. Marie and work our way through to Summer.
I think the mantra I'm working under right now is be kind. Be kind to yourself, be kind to the people around you. There are lots of reasons that we can be frustrated or angry. And what we can do about that is to try to put more in the kindness bank, if you will, both for ourselves and those around us. And thank you very much for convening this, Gabe and John. And Summer, it's nice to meet you. It's been a pleasure. It's been a pleasure.
Thank you so much. Dr. John?
Hey, I just want to say, pay attention to what people are telling you. Take this seriously. And we're going to all get through this together. We're going to come out and we're going to learn a lot of, I think, helpful lessons as a society, but also as individuals, how much resiliency that all of us have inside of us that we just maybe aren't even aware of and haven't yet tapped. So stay safe, and I hope to do this again.
Summer?
And thank you so much again for putting this together. I really hope it helps a lot of folks. It's hard to feel a sense of normalcy right now. So I would say my final recommendation would be to, so long as you're not, being in close contact with others, keep doing the things that you love, especially if those things are at home. I apologize if you hear the church bells from the church across the street. It's 2 o'clock apparently. So keep doing the things that you love. I like to say to my students when I'm teaching at the end of the semester, we are what we repeatedly do. So keep that in mind as you're choosing the activities that you want to engage in each day. You know, we don't necessarily want to be training ourselves to become even more anxious if we can help it. So focusing on the good things, the leisurely things, the distracting things, the social aspect, you know, of all of this, time with family and friends, even if that means through a screen. I think that's a good way to spend this uncertain time.
Thank you so much. And finally, thank you to everybody that is tuned in. We really appreciate all of you watching. And Anne, she says that she hopes that there are more of these sessions. We will see what we can do, and we'll see everybody next time. Thank you so much. Wave, everyone.
Thank you.